Dancing has been a huge part of my life since I was a little girl. I have taken my passion for dancing and I am passing it on to students and teaching lots of classes. When I was around 11, I started experimenting with eating disorder behaviors, and throughout my teens it just completely spiraled, and then I was hit with gastroparesis.
Gastroparesis is a condition in which the stomach is sluggish. When food enters the stomach, it will not pass through into the intestine as quickly as it should. This can cause patients to feel nauseous and bloated and uncomfortable. And in some cases, it can be difficult to get adequate nutrition because the nutrition is not reaching the intestine. So some patients actually need direct feeding into the intestine with a feeding tube of some type.
My first experience with feeding tubes was when I was going through the blows of my eating disorder and I was inpatient. And I was actually very thankful to receive my first nasojejunal tube.
Nasojejunal tubes are feeding tubes that go from the nose and into the small intestine. The challenge is that to have a tube in the nose for weeks or even months at a time can be very uncomfortable. So for some patients, we decide that they need a more convenient, longer-term feeding method, and a tube that's placed directly into the abdominal wall, into the stomach or intestine, can be much more convenient for some patients.
After about 6 or 8 months, my doctor and I together decided that it was time to move on from an NJ tube to something, in my abdomen. But then we decided to do a combo, one that would go into my stomach and my jejunum. Unfortunately, within, I think, a couple weeks, the portion that descends down, it flipped into my stomach. And I experienced pain when that happened. Not everyone does. People have different symptoms. I knew that something was wrong. So they had to pull that one and tried it again. They tried multiple times over a few months. And it was just an endless, it was, in the hospital, out of the hospital, in and out. And it was very frustrating, and I just wanted to dance and live my life. I was referred to another GI surgeon that I hadn't worked with before, and he suggested Boston Scientific.
For gastroparesis patients, feeding directly into the stomach doesn't solve their problem because the stomach is sluggish. The endovev jejunal tube threads through the existing feeding tube and allows us to feed directly into the small intestine. The endovev tube has a suture on the end that allows us to clip it into the intestine where it stays. The really nice part of it is that after the procedure, patients can begin feeding in the intestine right away, and many patients that day start getting good nutrition and really notice a significant improvement.
When the time came for replacement, it really was just because of wear and tear from using it every day, and it was just, it needed to be swapped out, but that clip was still there, strong.
The biggest challenge for gastroparesis patients is that they often are hospitalized multiple times, requiring an array of medications that can also be quite expensive. So all of those emergency room visits and hospital visits can sometimes be minimized by an effective feeding regimen through the jejunum.
Having the Boston Scientific feeding tube is nice in addition because it has this discreet look, and I'm a 20-something-year-old girl. I want to look nice and be able to socialize in different ways and not feel uncomfortable.
This is also of really huge importance to a patient's quality of life, because coming to the hospital or coming to the emergency room on a weekly or monthly basis is very, very difficult. Many patients with a jejunal feeding tube can then manage their nutrition at home and feel great doing it.
My life today is so different than I ever imagined. I feel more like my old self, and I can do more, and dancing, my number one. I'm here, I'm at the studio, I'm spreading my love for it to other people. I am very lucky to have Boston Scientific come into my life, because I don't know if I would be here today, sitting here and sharing my story. I am able to participate in life now.